Hello, my name is Tablo, and today I will present a small presentation about the fracture of the bone. And as a content, I would like to talk about what I will present in this presentation. I will talk about bone, like what is the overall idea of the bone and what kind of problems that bone can have, as we know that every system and every organ can have problems. Then we will talk about the fracture of the bone. What is bone fracture? To understand it, then we will talk about the types of the fracture. How many types do we have? Then we are talking about the signs and symptoms. How to know if somebody is having a bone fracture. Then how to manage and give treatment to somebody with a bone fracture. Then how to advise someone, to advise people to reduce their chance of getting a bone fracture. What is the bone? Bone is an organ in human body, or a system in human body, or in every vertebrate animals, and it works on giving a shape and protects the internal organs. It also works on producing red and white blood cells, works on storing minerals in the body, providing a structure that helps to give movement and enables the mobility, helps you to move freely, easily. How many kinds a bone can suffer from, or how many problems a bone can have? Like we said that every system can have its own problems that will give them to ability to be disabled or not used after that, that give a human being or any other animals a problem of living normally and easily. The problems that bone can have are diseases, like bone diseases. The most known bone disease is osteoporosis. Like it's the most known one, and it happens a lot in human beings. Then we have dislocation of the bone, when the bones are moving from their own location. It usually occurs at the joints. Then we have fracture of the bone, or the bone break, when a break occurs in the bone or the crack occurs in the bone. It's a fracture. Then we have rheumatism. What is rheumatism? Rheumatism is when the cell's immune system attacks itself, like the cells are fighting each other of their own kind in human body. Then what is the fracture? We said that we will talk about fracture in this presentation, and to show what is the fracture. Fracture is a crackness or the brokenness on the bones that happens when a force that is bigger than a force of the bone itself occurs on it. Like when we try to punch a wall, the force of the wall is bigger than our hand's force. So that will lead to giving us a fracture in our hand's bone. And the most common places that a bone can be fractured in are wrist, ankle, and hip. They are the most common places. We have many types of the bone fracture, but the ones that we are talking about are the main ones, or the most common ones, like green stick, transverse, spiral, oblique, compression, segmentation, and avulsion. And I will talk about all of them detailedly to tell the difference of why each one of them is different from the other. And there are other types that also related to the types I just named, but we are calling them the other type because some of them are open or closed. By open, we mean when the bone is broken, it comes out, it reaches the soft tissue, it reaches the muscles and skin and comes out. You can see it with your naked eye. And they usually take much longer time to heal. Then we have closed fracture. Closed fracture is serious fracture, just like the open one, but it occurs inside the body. It doesn't rip off the skin to come out. We have displaced and non-displaced. Displaced is when the bone is broken, but also moving from its origin place and is in the other place. In order to fix and heal this type of fracture, the provider or the doctor needs to give the surgery. Like this kind of fracture is the most likely to require surgery to be repaired, while non-displaced are still broken bone, but the pieces of the broken are still in their own place and they are not moved. Green stick. We said we will talk about the types detailedly, and now green stick, it's called green stick because it's like a stick when you bend it and side of it crack. It's mostly a crack from only one side. It doesn't go through all of the bone as it's seen in this figure. Transverse is when the bone is horizontally broken, like the broken is go through all of the bone horizontally or in the opposite direction of the bone, and you can call it the complete fracture because the bone is completely broken. Spiral, the name came from spinning, or when you spin something, twist something around, give it a wrap. And this type of the broken bone is when the bone breaks, it also wraps around itself. It's like you twist the bone, then it breaks. Then we have oblique. Oblique is also go through the bone fracture, is also a total, like a complete fracture, but to make a difference with the transverse and the oblique, transverse doesn't make any angle when it is broken, while oblique is giving the broken bone an angle. That's how you can tell the difference between oblique and transverse. Compression is a collapse of the vertebra. When the vertebra is weakening or very weak and very harsh, they break. And this weakening is seen in the patients with osteoporosis or osteogenesis impact. Like when the patient is in a severe case of osteoporosis, you can see that their vertebra is collapsing and they are having a compression fracture. Then we have segmentation. Segmentation is the easiest to be known among all of them because in the segmentation, the same bone is broken in 2 or 3 sides that you can take the broken sides and separate it from the total bone easily. That's how you can know it's segmental. In this figure, this is a thigh image. We can see that there is 3 parts of the bone. The first one is the upper part that you can be seen, and then we have the first side of the broken bone, then the second side of the broken bone. The middle part is the broken part that you can separate it easily. Then we have avulsion. Avulsion is more like a failure than being a fracture, but still called a fracture, and it happens when the soft tissues pulls the bone away from the bone body. Like you can see in this area that the soft tissues is pulling the bone to itself, then being attached to other part. What are the causes and symptoms of fracture. Like there are a lot of things that happens that will lead to fracture of the bone, but the main ones that happens daily nowadays are car accidents, falls, and sport injuries. Like these are the top 3 reasons for the fracture of the bone. And we have symptoms of bone fracture. In the case of bone fractures, we only mention these 3 because they are happening a lot. But we could also mention hitting. When someone hits somebody with a lot of pressure, they also break their bones. But these are the main ones. Symptoms of the bone fracture. Like how to know if somebody's bone is broken. You can see that they are in a very severe pain. So pain is one of the symptoms. Then swallowing. The area that the bone broken in it is very swallowing. Then tenderness. You can see that it is red and they are not able to move the part that is broken. There is bruise in the broken part. There is dislocation, like you can easily see that the location that is broken is not in its origin place, and you can see a bump or a big bump are forming in that area that is broken, that you in a normal condition cannot see because it is not exist. How to diagnose? The providers and doctors or the surgeons that are responsible of the cases, they know it is a bone fracture when they see it, but in order to confirm, they use X-ray. Like X-ray is to confirm the type of the fracture, also to show how damaged the tissue are, like how damaged the bones are. Then they use MRI. MRI is to see the complete picture of the bone, of the tissues, of the surrounded area, to see how damaged it is, to see every details of the bone fracture, so they can decide if surgery is needed or not. Then we can see, we can use CT scan to give a more detailed picture, in order that the provider couldn't decide by X-ray if surgery is needed or how damaged the fracture is. They will take CT scan to see more detailed pictures of the bone and also of the tissues around it. Then the management and treatment. If it's just a normal bone fracture, it is not open fracture, if it's not dislocated, the provider will use splint or cast. Splint usually used for short while, like 5 or 3 weeks, 3 to 5 weeks, while the cast is for longer while. The cast will be for a month or 2 months, according to the fracture and how fast a bone can heal itself. Then we have surgery. For some types of the fracture, the surgery is very needed. For example, if it's dislocational fraction, or if it's open fraction, the provider will decide for the surgery. Also the location of the fracture and decides of how bad the fracture is, that will give the provider a right to do the surgery. We have bone grafting. What is bone grafting? And why do the provider or the surgeon or the doctor will use it? In some cases that we can see that the bone is very harmed, it is very broken, it's broken to very small pieces, it cannot be healed. Casting or surgery cannot be helped for this type of the fracture. The surgeon will insert additional bone to help the tissue to rejoin fractured bones together, because the broken bones itself cannot be healed. That's why they will add additional bone that will help it to heal and rejoin itself together. Then how to reduce. We will talk about how to reduce the risks. When you are driving a car or when you are sitting in the car, please wear your seat belts. Your seat belts is for safety of you and your body. It's not only helping you to reduce the risk of bone fracture, it also helps you to reduce the chance of dying. Then wear right protective equipment for activities and support. When you are doing a ride biking, or when you are biking or when you are riding a bike, when you are doing kickboxing or hard activities like climbing a mountain, please wear the protective equipments that help you to protect your body, your skin, your bone. It will help you to not get injuries. When you are at home or at a workplace, use the equipment or the instruments that will help you do your works, do your jobs, do your duty in a safe way instead of putting you in danger. A diet and a healthy plan can maintain a healthy bone, a strong bone for you, that can also help you to reduce the chance of getting a fractures. If you are on a poor diet that you cannot get a lot of vitamins or you cannot get calcium from it, you can see that your bone is harsh and your bone is weak, can be easily broken from a minimum amount of force. But if you have a healthy diet, you can have enough calcium, you can have enough vitamin for you. You can see that your bone can stand a bigger amount of force that will help you to protect you. These are the references, some of the references, because I used a lot actually. And thank you.